good evening, everyone. I hope you can hear me all okay. I'm using some new headphones here. So I just wanted to introduce myself. My name is Dr. Farrar Duro. I'm a licensed acupuncture physician and reproductive acupuncturist. We will be joined today by Dr. Jessica Bauer, and also we are going to have a special guest, Sandra Elidor, with us. So it's going to be a kind of a mixture of questions and answers, and then hopefully some inspiration to help you on your journey, whether you are trying to conceive on your own naturally or you're trying a medicated cycle. So just give a little wave and type in the chat if you're hearing me okay tonight. And we will also look for, oh, there she is, Dr. Bauer, to be joining us right now. So with us. So let's wait for her to come in. Oh, okay, whoops. Well, it was declined a bit. I think she's coming back in. So she'll just request that again if you can, that request, and then we'll go ahead and get Dr. Bauer on as well. So tonight we actually have questions that were submitted before, so we are going to get to those questions first, and then we're actually going to be able to, let me go into, I'm going to send them a request again, Dr. Bauer. We're going to answer your questions live. So if you have anything that's on your mind, please let us know. Oh, there she is. Hi, how are you?
Hi, how are you?
Welcome, Dr. Bauer. How are you?
Thank you. You know how I am with these things. It's always a little.
No worries, that's okay. No worries at all. I know this has been a really busy week as well. We've had a lot of patients undergoing transfers, and so we've been actually attending those transfers, doing acupuncture this week as well. So we're excited to answer all these wonderful questions that we received too. But for those of our viewers who don't know you, if you could please introduce yourself, that would be great.
Yes, absolutely. So, hi everyone. I am Dr. Jessica Bauer. I am one of the newer members of the IVFMD team, and I function primarily out of the Boca Raton office. I've been in Florida for a little over 3 years. I hail from the Northeast, but did most of my training there, but found my way back down south. So very happy to be here. I love Dr. Duro. I love everything she does, and I'm very honored to have Sandra join us. I don't know if I need to add her, or do you need to add her?
Yes, we're going to actually welcome Sandra in around in a few minutes after we finish our Q&A. Yeah, so when Sandra will request to come in, I think, yeah, we want to actually get to some of these questions first, and this is going to be a really good opportunity because we both know Sandra. She's great. She's very inspirational. She's actually has support groups that she's found to be very helpful, and she started some of those for women who are undergoing fertility treatments too. So, so it's my honor. And next week, just to let you guys know, it's National Infertility Awareness Week. So we are going to be bringing different resources to you. We're actually going to be doing something really fun on Thursday night. We're going to do a virtual fertility yoga session on Zoom. So that'll be fun and new. Yeah, just very, very calming. The partners can join. It's totally, it'll be a virtual. I'm not gonna be able to see you, but but yeah, you're welcome to join us too. Yeah. So it'll be, I think it'll be really fun. And so let's go ahead and then, and I'd say these questions tonight, they are concerning egg quality, supplements, things like that. We do get asked certain questions, but I actually had to research some of these supplements because they are not commonly known, I guess, in Chinese medicine. Some of them come from the Indian Ayurvedic tradition, and actually I found this is a question about male fertility that I'll just jump in with this one. Whoever asked this question, they have done their research. So thank you, Amanda. That was who asked this question. Is Avena sativa, Tribulus terratus, and fenugreek extract okay for men while trying to conceive? So I guess what I was trying to say is that, you know, these, like 3 of them, they're all different, right? Supplements. So they're all different herbs. They all have different actions. And I believe on a prior Q&A, Dr. Wood actually had a fenugreek question come up for a male patient who was taking that, and we actually spoke about that, and it is toxic. So we just don't want to recommend that one. But on the other question, Avena sativa is like oats. That's what it is. So oatmeal, you know, but it actually is protective for male fertility. So this is something that was actually a research paper that came out from India that tested this theory on fluoride toxicity in rats. And so they actually found that with this extract of Avena sativa, it actually helped improve sperm quality. And it actually acted as a protective effect against fluoride-induced infertility. So fluoride, we know, is found in water. It's also in several products, but at a high dose, it is not good for fertility. And it actually lowers selenium in the testicles. So that's not good. So basically, what they found was that the treatment with this extract decreased damage to the reproductive organs, and it lessened the impact on sperm count, morphology, motility, and it actually decreased the toxic effect of fluoride. So eat your oatmeal, right? That's good, you know. And then the other one was tribulus. So tribulus is actually an herb that's found, you know, in certain male fertility supplements, and that one comes up quite a bit. It actually is one of those that can be helpful. I actually printed out some information there. I wish I could screenshot this to you guys, but I can't share it right now. But anyway, that one is also, that research came out of Iran, and so it actually is shown also to be okay to take and helpful, but you have to take it from the right part of the plant. And the only helpful thing that I found, even Chinese herbology, and Chinese herbology, we use tribulus. That's not the right one. Actually, it has to be from Bulgaria. So just remember to do your research. It has to be a specific type of tribulus. It's important. And the only one that I have found that actually was effective for male fertility, that reduces oxidative damage, was actually from Bulgaria. So make sure that's where it's come from. So do you have any feedback on that, or have you had anybody come to you with concerns about supplement selection?
Yeah, no, you're actually teaching me some things, which is great. You know, that's why I think it's so important that we work synergistically with our friends. You know, when we're talking about you know, fertility, because it is so multifactorial. I like I said, my knowledge is relatively limited, you know, regarding, you know, Chinese herbs and those specific things. So I defer to, you know, everything that you said, and certainly the general rule, you know, if you're having a male fertility problem, or you just sort of want to be proactive, that high levels of antioxidants are certainly going to be, you know, are going to be helpful. And then, you know, in addition to all of that, making sure that if you have someone that is, you know, avoiding hot tubs and saunas and high heat, you know, scenarios, in addition to potentially these herbs as well as antioxidant supplements, is really where you're going to get the most bang for your buck.
Right. I mean, there's so much out there. That's the thing. You can get really overwhelmed. And honestly, we always say food is the first medicine. It's going to have to come from food. We agree with that, like eating lots of antioxidants and eating the rainbow. So that's where we start with our patients. And then we can add in certain things as needed. You know, I do think that the stress relieving techniques, yoga, I've been really talking about yoga a lot more, because from India, they actually had research on male fertility and actually yoga improving male fertility. So I think it's great to look at, you know, what we can do that's easy to do, something you can do at home right now, because of everyone, you know, some people are going to the gym, some are not, some people are vaccinated, some people are not. So trying to see what things we can do proactively to help with reducing oxidative stress, like we said, and you know, that's starting from, we give our patients a 6-week meal plan. It's Mediterranean based, and then incorporating certain supplements if they're helpful. We don't want to overwhelm the body either, you know. And we actually had someone who was coming in who has not been going to the bathroom regularly. And if you are only going to the bathroom once or twice a week, but you're also pumping your body full of supplements, what are we really absorbing? I mean, how is our detoxification system? So we need to work on that first, honestly. So this is why we say if you can work on certain things preconception wise, we have a few months of time to work with these things prior to jumping into a medicated cycle or that sort of thing, then that is really optimizing your body for pregnancy. And for men, just as important, trying to get as many healthy sperm as possible. There's no such thing as having too many healthy sperm, right? So,
No,
so
more than
you can,
merrier.
yeah. So the guys can do their part. I mean, if it means like switching up the diet a little bit, trying to stay away from toxins, quitting drinking for a
Alcohol.
little while, and yeah, working
Very
with that,
there too.
and doing some yoga. Why not?
Yeah,
It's a good thing to do together, right? You can,
absolutely.
yeah. So thank you for that wonderful question. That was like three
Yeah.
parts, but it was very in depth. And that brings us to another supplement question. We're going to try to get to the supplement questions first. But I just also want to jump into the chat where someone is asking that their FET is scheduled for the end of May. Would someone from Florida Complete Wellness be able to come to the transfer to do acupuncture right before the procedure? And we are so honored to be working with the staff at IVFMD that they allow their patients to do acupuncture during transfer and to do things that are helpful for them. So as long as that you are going to a clinic that allows us to be there, we will be there. So you just need to contact our front desk and let us know ahead of time as much in advance as possible. And what we do is we try to arrange our schedule, and our patients are awesome too because they understand that we are only there's only two of us actually that they go to these transfers in our office, and we're able to arrange our patients that way to help with that. So if you're able to book that with if you're going to IVFMD, then you can ask your doctor and also tell the staff that you'd like to have acupuncture, and then we'll be able to join you there. And if you're going to another clinic, just make sure that that's part of your treatment if you're able to do that. And it's okay with your doctor. And so, anything to add to that, or
No,
okay?
they
You're in
want
the
you
Boca office, but
to get them in there.
do you do your transfers in Boca also, or is it done in other
Um,
offices?
so no, Boca doesn't have the embryology laboratory. So I do my transfers actually up in the Jupiter office. So
Oh, okay, yeah. So really, we've got you covered from Jupiter down to South Miami.
yeah,
So
absolutely.
you have help. Um, and we also have patients that are coming from different areas, or they're doing their treatments in other countries even. So they're trying to do treatments prior to that. So it just, we can work virtually as well as IVFMD. As you guys do a lot of work virtually too. I always tell
We're-
patients, get a second opinion. It doesn't hurt to have another pair of eyeballs looking at your treatment,
yeah, absolutely.
because they might be able to see it a different way. And you guys are like detectives, like you can find everything, whatever obstacles there are. It's like you can turn them over, And I think that's great that you guys do that research. So the best supplements to improve egg quality, that was another question that we
Yeah,
received.
yeah, absolutely. So when I'm generally, and we can certainly tag team on this one because I think it comes from both sides. So I generally, for especially for my patients that have diminished ovarian reserve, I think it's very important that they be on a coenzyme Q10
Mhm.
supplement. And again, it's really super important to make sure that you're on a high quality supplement, just because there certainly are a lot of lesser quality or counterfeit products out there, like especially on Amazon and whatnot. But coenzyme Q10 is really productive. Getting in omega-3 fatty acids, which have significant anti-inflammatory properties, as does turmeric products also can really help with anti-inflammation and also antioxidant properties. To go along with that, I would say alpha lipoic acid as well as L-arginine are also part of one of the great cocktails that I will use for my patients that are looking to really use supplements to help improve egg quality. And sort of a nice thing that we have, because all of our physicians at IVFMD are really dedicated to high quality supplements, is that we've all sort of put our heads together along with Marta, our lifestyle and nutrition expert, and found brands for each of these supplements that we know can be beneficial, that we have researched and studied and have been shown to really have high quality products. So those are available at all of our offices as well. And when you have your consultation with the doctor, I go over with my patients why I think they need these things, and then they have the ability to get the supplements at the office. So generally those are CoQ10, turmeric, omega-3 fatty acids, alpha lipoic acid, as well as L-arginine are also are really good. And also making sure, of course, that your vitamin D level, D as in dog, is normal is very important as well. So make sure your doctor checks that level, and if you need supplementation, we can provide that for you too.
And it's so awesome that you mentioned that too, because some people actually, I had a patient earlier that didn't have her D level checked before doing her IVF, and I'm like, that's strange. That's a simple thing to do, right? But it's like there are optimal levels that you want to have during pregnancy too. So you want to look at the body not just as the end goal is to get pregnant, but to actually have a healthy pregnancy, and that's why these things are important. So yeah, you guys have an awesome nutritionist, Marta, that actually goes through inflammatory markers and so many things, and making sure that everything is right, all the conditions are right before you go into that cycle, because it's a big investment, and it's a big investment on money, time, mentally, emotionally. So it's kind of like, why not give it all that you can, and make sure that everything is working right. And we have patients that are in their 40s that look, to me, I don't know, but I think Marta agrees too. They look on paper like better than people in their early 30s, sometimes, because they have been just so good with they're following their nutrition plans, and like just working with different things holistically prior to, and maybe it took a little bit more time before they got to that point where they could start their stimulation, but they're going into it phenomenally well and way better prepared than they were before.
Everything that I say all the time, of course we want our family now, we want it yesterday, but if you're not optimizing your body and just rushing through for the sake of rushing through because you're worried about time, your outcome is not going to be as as good as if you were to take the time, like you said, to really optimize things. Just slow down for a second. We're not talking it's going to take 6 months or anything like that. Take a couple months or a month to really take a look at things, and and speak with your doctor about how you can really optimize yourself so you can have the best outcome.
For sure, yeah. And you guys are one of the places that do that. There are others that don't really look at those things, and I think it's important, to consider the big picture. You're more than your ovaries, or you're more than a number, If it were that simple, then then we would have 100% IVF success rates across the board worldwide, but that's not the reality of it, unfortunately. So we need to do everything we can, and sometimes some of us have more obstacles than others, and so the more obstacles we have, the harder we have to work a little bit at trying to address those things beforehand. So there's a question about ubiquinol. Is Quinol a good brand? Are you familiar with? I'm not sure if I've heard of that one.
I'd love to see it.
It looks like it's Quinol, and someone's typed in the chat. So
OL. I'm not as familiar with that brand. I'm so spoiled by having everything at my
right.
own. I just say
yeah.
Terrible. In general, a pure encapsulations is generally a really good brand. I'm trying to look here at everything at my ubiquinol. I don't see it, but I'm happy to, if that person wants to connect later, I'm happy to do some research and take a look. But generally, Coast Science and Pure Encapsulations and Nordic Naturals make really, really good high quality products.
Yes, definitely. And I found the Fairhaven brand too. We've been using some of theirs. They have one that actually has alpha lipoic acid included in it, which is nice because that's what I was looking for too. You have to kind of look around, and definitely you want to go for quality because they're not all the same.
Oh.
Someone said turmeric, they were not sure if that was indicated because they are under pressure that it might not be good for fertility or dealing with infertility. It's not good to take turmeric. Would you have any feedback on that?
So turmeric is known to, in particular, to have a lot of anti-inflammatory properties. So while it is not all of these supplements that I'm saying are not right for every person. If a person has been, tested and shown to have sort of systemic or body-wide, higher levels of inflammation, turmeric might be a better choice for that patient. So it wouldn't necessarily be across the board. And again, that just speaks to the importance of making sure that your treatment plan is tailored to what you're doing. But there are no negative effects of for turmeric on your fertility per se. It's not going to damage your egg quality, but it's certainly again, if there's an inflammatory process that is underlying, that certainly could be beneficial, but in the right patient. So it might not be right for every patient, for sure.
That is true. And a lot of times people will kind of copy what their friends are doing. So my friend took this, that, and then it's not right for them. So it's great to have those measurements done of your antioxidant or your oxidative stress levels and inflammatory markers to figure out if this is right. And also dosage and all those things are important. So it might not be that everybody is going to be taking the same thing, but again, I go with food, and you can use turmeric as a cooking spice. It's never going to be where you're going to, you're not going to have a ton of turmeric usually in your food, but you can have some. And some of these herbs and spices, they're very gentle to be using in your cooking. So if you're using good food, then why not try a little bit of those herbs in a very gentle way. And so as far as our questions go, I want to get back to a few of them that were submitted earlier that we had actually about how to check egg quality. That was actually one of the questions. So I would like if you could explain that a little bit more about how you check that.
Yeah, no problem. So so they're really, I wish there was a magic blood test that I draw your blood and I say, voila, you have excellent egg quality or you have mediocre egg quality. There really isn't per se a one specific test that tells me about egg quality. But what we do have at our disposal are things that we're able to test for relative egg quantity, okay? Because as women, we're born with however many eggs we'll ever have, and over the course of our life, we lose them, but that happens for every woman at a different rate. And so the combination of using things like vaginal ultrasound, which is used to look at follicle counts, and the combination of doing specific hormone tests early on in your menstrual cycle, as well as another hormone called anti-Müllerian hormone, or AMH. The combination of those things really give me an idea about where a woman stands from an ovarian reserve perspective. And it's important to understand that it's not any one of those things. It's really taking everything into context. And what I can tell you for sure is that anti-Müllerian hormone is the hormone that's secreted from the cells that surround a follicle being what houses the egg within the ovary. And if and a normal level generally is somewhere between about 2, an AMH of 2 to 5. And if you are falling sort of in that category, in that range, you're generally looking at a good egg quantity. And what I can tell you is that over time, we have learned that quantity does tend to correlate with quality. And so if you have a lower AMH or a lower egg quantity, there is certainly concern for egg quality. Okay, and so that is sort of how an assessment is made. The exception to that, which it can get tricky, and this is very nuanced, is in a scenario where you have PCOS, right? Polycystic ovarian syndrome is where you potentially could have an AMH that's very high, right? It falls outside of that normal range or that normal window. And then you're looking at a scenario where a patient may almost have too many eggs, and you're like, hey, Dr. Bauer, how could I have too many eggs? Like, eggs are great, I definitely, how could that be a problem? And where it does become a problem is that if you have too many eggs, if that AMH level is very high, potentially you might be sacrificing how you're able to nourish all of those eggs, right? And to make sure that each of them are getting the attention that they need in order to be higher quality. And so again, so just to summarize, sorry, I went off on a tangent kind of, but in order to check egg quality, we really need to make a quantity assessment. And we do that with vaginal ultrasound, hormone levels, and AMH, that's timed with your period. And it really needs to be taken into context of the rest of your history, because on the lower end, we may have a quantity and a quality problem, but also on the very high end, we might not have a quantity problem, but we might have a quality problem. So very individualized, but that's generally how we do it.
And definitely not all AMH tests are the same too, right? Because you guys use one lab that's, very specific for that. And some people will get it done other places and it's very different. So if you get that AMH number and it looks low, don't go off one number. I would definitely get that, like the whole thing that you were saying, ultrasound, blood work, all those things done, not because there's a lot of over-the-counter now AMH tests that are out there. So yeah.
Yeah, no, the assay, the way that the test is done makes a big difference, and that because there's reliability that goes along with how that test is done. And we routinely we like to use the Unilab. They have an excellent and well established assay that that has been proven to be quite accurate over time, and they have a vast database of their AMH levels according to age, and so you're able to get a lot of information from there. So yeah, no, certainly always go for a second a second lab evaluation if something if something's concerning or something seems off. For sure, I agree with that 100%.
Yeah, definitely. And we did have someone a while back who was very depressed about her AMH number, and turned out that it was actually wrong. Like she actually was going off a wrong number, and she got it rechecked, and an IUI, got pregnant right away. But I spent probably a good year completely convinced that she would never get pregnant. So I just really hope that, we don't want to like base everything off of that. It's really not what we want to see. So we have a question about interesting question that someone submitted saying, I found out I was pregnant only 2 days past ovulation. Is that common? Lines on test are strong ones too.
Yeah, I saw this one. I'm going to go ahead and start with congratulations. I hope that, first of all, congratulations. I am so proud of you and hopeful that that this pregnancy will be the one for you. So, 2 days post ovulation does seem quite early in order to be able to detect on a pregnancy test. Sometimes in women that have irregular periods or potentially have varying days when they're having ovulation, sometimes it can be really tricky to track. I think the way to really know for sure what's going on if the pregnancy test is in fact positive is to go to your doctor and definitely get a blood test to confirm that what the pregnancy hormone level is. So yes, I think 2 days is generally pretty early. Normally we see it about 2 weeks after, generally, but you never know. Things can be off. You might have thought your period started this time, but maybe it was this time. And sometimes you can have abnormal bleeding in the beginning of pregnancy. And so I'm gonna stay positive and hope that everything is great, and go get a blood test.
Good luck. Fingers crossed. And I guess if you did a trigger shot, that would register pregnancy when you wasn't. Yes.
Yeah, I didn't even think of that. You're good. Of course. Oh, if you took a trigger shot, an Avidril shot, if you're in the middle of of treatment, absolutely, that's going to register as positive for it can register for positive like up to 5 days. So it's really important that you wait until that has flushed out of the system. But yeah, no, I guess I just assumed that they were talking about a good old natural cycle.
Yeah, possibly. Yeah, definitely. And I mean, I just, it's one of those things where we definitely hope that it's the case where if you go in for a blood work, though, they'll definitely show that. And I think it's like 10 days after ovulation, you could probably go in for blood work, or is that too soon? Like, or you want to wait about 12 days
Yeah, 10 to 12,
afterwards?
depending on
Yeah.
how long your cycle is. That's totally reasonable.
Okay, and then we actually have a question that was submitted in Spanish. That basically, this might be like an OB question. It looks like that they're pregnant 30 weeks and wondered about how much iron to take if their hemoglobin's low.
Right.
Do you have any feedback on
I
that?
can still do that. I used to do OB back.
Okay.
So it truly depends on how low the iron is. Generally, iron comes in, it can be in 325 milligrams. And sometimes we cater, if the hemoglobin is very low, you might consider trying to take it 3 times a day. If it's only mildly low, you might consider 2, or, just a little bit low, you might consider 1. And so generally an over-the-counter iron supplement is good. It's very important. Sometimes vitamin C, if you take the iron with vitamin C, that can actually help with the absorption of the iron, because that generally is the problem. You can take a lot of iron, but you might not be absorbing all of it. So vitamin C with iron can aid in absorption, but generally the 325 milligrams in varying times of the day is a good dose to start at. But you should always, of course, ask your obstetrician or the person taking care of you in your pregnancy.
Definitely. And it's normal to be a little lower, right, when you're pregnant because your blood volume's increasing. So it might be that yes, but it's still pretty, important to make sure that it doesn't go too low. Right? So, and as far as we have, let's see, 2 more questions, I think, maybe 3, actually 4, 4 more questions we'll get to, and then we'll bring Sandra on. So, but I do know that the person who actually submitted this ahead of time, she's actually here on the chat too, and she's asking the question on the chat as well about day 3 transfer versus day 5.
Yeah.
So if you could maybe address that, that'd be great.
So I would say that the vast majority, let me start by saying that that IVF technology and our knowledge of embryology and what an embryo is capable of on day 3 of life versus day 5 has really evolved drastically, even over the past 5 to 7 years. And I would say that back when I was in training, which was not that long ago, that I did see more things happening day 3, including embryo transfers, including potentially, biopsies occurring on day 3. But what we have learned over time with large scale studies is that embryo transfers are far more successful when you can do them when the embryo is at what we call the blastocyst stage, which is when they're day 5. And so generally the pendulum has swung significantly. And I almost just about everyone in our practice, I would say, prioritizes and prefers to do everything day 5, of course, if the embryo can make it. Sometimes if an embryo is not looking of high quality, there's some thought that that embryo potentially would have more of a chance if it were transferred to you as opposed to continue to grow in the incubator. But again, it's a very doctor specific preference. I think that it is definitely preferable to do an embryo transfer day 5 if possible. So I wouldn't say that. I was trying to make sure I answered the question because I got off topic, but I would say day 3 in antique. Is transfer day 3 in antique method. Is that the one we were answering?
It's equated, I guess. Yeah, I
Yeah,
guess
yeah.
it's just
So
yeah.
it absolutely has. And to answer the second part of the question was, which is, does it have any possibility to implant? Yes, absolutely, it does.
Hmm.
But generally, we are finding higher pregnancy rates when we do a day 5 transfer. Is the overarching theme there?
And even day 6, right? The other day I saw when someone's actually they're hatching. I mean, literally, when you guys are transferring them, sometimes the little they're really getting they're very developed. So I guess
Yeah.
you guys have your preferences too, and to what is there a difference between day 5, day 6, or
The,
you prefer
there
either one?
So the gold standard is going to be a day 5 embryo, but occasionally an embryo can be slightly slower growing, okay? And it
Mm-hmm.
needs to, in order to achieve the characteristics that we like to see, sometimes it takes an extra day. Day 5 and day 6 are generally, for the most part, pretty equivalent. We even
Mm-hmm.
do grow embryos out to day 7. However, there definitely is a disadvantage to considering transferring a day 7 embryo. The chance of pregnancy is definitely going to be lower with a day 7 embryo compared to day 5 or day 6.
Right, and long ago, they used to actually do day two transfers, and day two or like little 4 cell, right? It's that
Yeah,
probably is 4 or 6
4.
cell, yeah, very small, and they would put in 5 or 6 embryos at a time. So that was kind of how things were done. Just like, okay, we'll just put them all in. We have no idea if they're good or not. We'll just see what sticks,
Yeah,
and it's then you see what happened with lots of multiples, sometimes, but nowadays, I think it's a little more precise because you guys are doing more embryo testing, and before you transfer and to be tested, they need to be blastocysts, right? So, yeah.
yeah.
So that's important. So I guess it depends on where you're going, but some places are still doing those day 2, day 3 embryos too. So it just depends on their.
Yeah.
I guess you can go to SART and you can find out the success rates, right? So
You have
you'll see
to start.
SART.org. Yes.
Yep.
I always recommend because at least you can compare your age group too and
Yep.
your area, and you can see if this practice is doing that, then let's see what the success rates are. And that's kind of it's a good thing to do. So it's SART.org if you guys want that website. You can type in your zip code and it'll pull up all the clinics in your area, and you can kind of compare, them. Um, and so, as far as our questions go, I know we're getting into inviting Sandra soon, but I just wanted to answer these really quick because there are a few COVID vaccine questions that have come up. So, and things are changing all the time, and all this news came out now about the Johnson & Johnson one and all this.
No,
So, what is your view on when someone should receive the vaccine if they are trying to conceive or they're trying to do an IVF cycle?
definitely. And so let me preface this with, I think it is a very personal decision between that you should have with you and your doctor, especially if you are going through fertility treatments, because inherent to this process is that all of this information, this is new for everyone, including doctors, including patients, including everyone. And so everyone's feelings on how they interpret that information and how they want to be able to advise their patients is going to be different. So my disclaimer is that you absolutely should be having a conversation with your doctor about what is going to be right for you. And because it's very personal. So, what we do know is that the American Society for Reproductive Medicine, the American Board of Obstetrics and Gynecology, certainly the CDC, all have recommended from the very beginning that a COVID vaccine should never be withheld from any woman that is either pregnant or trying to get pregnant if they are eligible for the vaccine. And so first of all, don't let anyone tell you that you can't get it if you want it. So that's the first thing. And so I would say that my personal view, again, and it might not be what other doctors think, but I'm the one here, right? So you get to hear my opinion. Is that inherent to the vaccine process? The way that a vaccine process works is that it ramps up your immune system, right? Because it needs to mount the response and develop the antibodies that it needs in order to protect you. And inherent to that immune response is also an increase in inflammation in some regard. And so my only hesitancy would be having that process done in and around the time of something, say an embryo transfer, for example, when if someone in particular, a patient is particularly prone to having an inflammatory problem or an immunological problem that the doctor identified previously, you potentially could be exacerbating that problem and potentially, or maybe not, decreasing the chance of success. We don't have the data yet. So what I would say, certainly, if you're planning an embryo transfer, first of all, speak to your doctor and maybe consider taking, taking a month between getting your vaccine and then doing your embryo transfer to allow the immunological system and the inflammation to potentially sort of quiet down a little bit to get yourself back, and in that regard. And certainly my other opinion regarding, getting it while pregnant is certainly we know that the effects of getting COVID-19 when you're pregnant can be very serious compared to if you were someone who was not pregnant. Okay. And so again, you have to weigh the risks and benefits of what your risk of exposure is. Are you an ICU nurse that works in a COVID unit, or are you an individual that exclusively works from home and stays home, and what is your level of risk in and what is going to be the benefit to you to get the COVID vaccine. So it's a polarizing debate. You ask 10 different doctors, you might get 10 different answers. But I just can't emphasize enough that you should have a conversation with your doctor. And if the vaccine is available to you and you want it, you absolutely should get it.
No, definitely. And we all received a bulletin from the Florida Department of Health about if you're experiencing chest pain, headaches, and you had that Johnson & Johnson vaccine, I guess they found that the prevalence is increased more in women who had issues with blood clotting. It's basically just make sure you tell your doctor those things if it's within a month of the vaccine. So it's rare, but at least it's worth noting that, those things are not normal, like daily headaches and, leg pain, all these different things. So it's good to check.
And I also just want to throw out there that the number, what we're experiencing with these, people are like, oh, I'm not going to get the Johnson & Johnson vaccine because of what happened, but you need to also realize that this is how the process works. We're rolling out phase 4 of a vaccine trial. That's what we're doing right now. And as adverse effects pop up, they're noted, and any sort of abnormality, out of an abundance of caution, everything is halted so that they can look further into it. And I think from what I read most recently, I believe it was 6 women that they had in the millions of people that have received it. And the percentage of that so far is exceedingly low. It's like 0.00000008%, or like something like that. Whereas it's important to understand that there are other things like birth control pills or smoking while you're taking birth control pills, or that are also increase your risk far more of getting a blood clot than the percentage that has been identified by the Johnson & Johnson vaccine trial thus far. Okay. And that's not to say that there isn't a real problem, but we need to, only time will tell, whether or not it's a real thing.
Well, thank you for clarifying that, because that question will continue to come up until we are completely done with COVID. Eventually, whenever that is, because things are always changing. So, and it's confusing for a lot of women right now who are going through fertility treatment of like, should I delay? Should I, go ahead and do the vaccine before my cycle? But I think if you can use that time to do your preconception work and, work with all the things that you need to work with prior to that, then that's a good recommendation too. So, another question was about acupuncture. Does it help with endometriosis? So in that note, I'm going to bring Sandra on. Let's see if I can do this. There she is. I'm going to send her a request now. So because I'd love for her to talk to you guys. Hi, Sandra. How are you?
Hi, everyone.
The endometriosis question came up, so I use that as an intro because we have done a live before about endometriosis, and
Yes,
it
yes.
was super helpful, I think. So thank you for coming on. And you also know Dr. Bauer, so
I do. Hey,
yay.
Dr. Farrar.
It's fun. See
So
you.
would you like to please introduce yourself, and we'd love to get your take on your treatment and what you went through, and if you could share some words of wisdom too with women who are struggling.
All right. Hello, everyone. I hope everyone's having a good day. My name is Sandra Elidor. I am the founder of Filling Empty Wounds. And I started this because of my story. And it got to the point I was like, wait a minute, there's no way. I am going through this, and I'm hoping others don't have to go through this. So if I can start a foundation where I can eventually provide funding for infertility and get the resources, get the advocacy, and educate, because for me with endometriosis, it took me 21 years to be diagnosed with endometriosis. And that's 21 years of pain, me going in and out of the hospital and doctor's offices, and no one believing that I even have it or what it actually is. So, of course, as you know, research shows it's usually around the age, bearing ages when we're ready to have a children, and this comes up. I'm infertile. I'm having issue conceiving because of one of the causes is my endometriosis, which caused lower ovarian reserve, which caused so many other issues that I got into the point I have to share my story. And it started me sharing one to two to three to people coming to me and asking me for advice. So now I'm like, I enjoy every minute of it. I enjoy telling people my story, giving them advice, and sending them recommendations to see doctors. Like, hey, this is the things you should ask for, because we really don't know. In the beginning, we're clueless about everything and we don't know what it looks like. So having someone that already been through it make it feel a little easier. Now I'm scary to go see a doctor. I'm like, hey, and I think a lot of people said to have that conversation with their doctor and let them know I feel somewhat inadequate. I don't know.
Disconnected, so we're coming back. Hopefully, you guys will get a notification that we're back. And if Dr. Bauer's still here, we'll bring her back on to do our fertility live again. Let me just make sure. And Sandra, if you're there, oh, here's Dr. Bauer. Let me go ahead and put her in. Sandra's there too, so we'll get back on. So sorry, everyone. So we're waiting for, there she is.
I don't know what happened.
know
I promise I didn't touch anything. It wasn't me.
It's okay. It's Mercury in retrograde. That's what technical difficulties here. And then let's see if Sandra, she was in the middle of speaking, but I don't see her now. I'm sorry. Well, we will definitely reconvene with Sandra too one day. I think that it was probably a connection issue, so I'm not sure. But thank you guys for coming back.
Yeah.
It happens, right?
Yeah.
It's part of being live.
Yeah.
So Sandra was speaking. I want her to speak about her story and dealing with her endometriosis. We actually talked about this on another live, but we'll, oh, there she is. Okay, let me see if we can get her back. We'll try one more time to have her back here. And if it doesn't work out, oh, there she is. Okay, yay. Are you here? She's coming in. Okay. If it doesn't work out, guys, we will be back next week as well. There she is. Hi.
Oh,
Are you good?
I'm good. Technology.
Yeah.
Gotta love technology.
That's okay. Well, for those of you guys who are rejoining us, they're still asking questions. That's great. If you could quickly, because we're almost to the end of our live now, if you could tell just a little bit about what's been helpful for you whenever you started to go through the diagnosis of endometriosis and what has also been helpful. Yeah.
What's been helpful, really, really helpful, is talking about it. it's really been helpful
Mhm.
just talking about it. You'll think a lot of us just want to keep it on, like no one understands, we don't want to speak, but you'll be surprised. This is the reason why people have therapy, is to talk.
Yeah.
So talking about it, especially to people that may or may not know about what you're going through, you get to teach someone else in the process. You get to, like, oh my gosh, start thinking about feelings that you never had, because now you can hear yourself saying it. So it has been very, very helpful just to talk about it, and making purposeful connection with my husband, just purposeful date nights, just connecting, and having that sacred space just for us to just enjoy each other's company. Because infertility, it works. It just take all the romantic out of it.
Yes,
100%.
that's good.
Yeah.
That's awesome. And as far as if someone's actually having, they want to reach out to you for support, how would they find you? Because I know that you have been on Clubhouse and you're on Instagram. So uh, how do they
Yes.
find you?
You can definitely find me on Instagram, here at Filling Empty Wounds. We post stuff all the time just so you can get your knowledge, your advocacy part. And Clubhouse has been very helpful, because now unlike a post, you can see the post, but now I get to hear everybody's story. And that's all over the world. We think it's taboo here. You haven't listened to taboo on the other side of the country.
Yeah.
So it's so therapeutic, and sometimes we're crying our eyes out, but to make that connection has been so helpful. And of course, we have an email list, so we can send things to you to connect with you, and find that group of sisters or a group of friends that you thought you never had, because now we have a common bond.
Very cool.
Mhm.
Thank you.
Yeah.
Thank you that for
About normalizing that this problem is so common. Fertility affects 1 in 8 couples. That's a
Yeah.
lot of people. It really,
Mm-hmm. Yeah.
and I
Yeah.
admire really everything that you have done, Sandra, with your platform, and just being able to speak about things. It's very personal, and
It is.
but knowing that there are other people who have gone through and continue to go through what you're going through, as you said, just talking about it can make such a world of difference. So
Mhm.
I encourage everyone to follow Sandra, and see what she's doing and see what she's talking about, because that it'll be like a snowball effect. You'll
Mhm.
find Sandra, and you'll find other people in the community. Hey, I have that exact story. And the bigger, and like the bigger web you can weave, and finding with all the support that you have, the better off you're going to be, 100%.
Yes.
So
Yes, and
I'm
that's what you want. That's somebody, immediate family may not understand because they never went through infertility, but who doesn't matter who's your sister, that neighbor. I've had people that I've been so close to, and later on they realized that they couldn't have it, and now they couldn't have their children, and now they're able to connect with me. And I would never have made connection with a lot of people if it wasn't for this story. And we don't want to be in connection in this way, but unfortunately, this is what was dealt to us. So we're making the most of it. And when you say normalizing, I like that, because cancer wasn't always this popular conversation.
right.
It's because people started sharing, people started talking, which caused people to have more research, to do more of these things. So a lot of us keep it harbor inside, but when we start talking, we realize that, oh my gosh, this is what I've been needing all this time.
Yeah.
And they will, people equivalent the diagnosis of infertility to a diagnosis of cancer in some, as far as the grief level.
Mm-hmm.
And that has been documented. So this is not something that you want to go through alone. I
You
mean,
don't. You
Definitely.
shouldn't have
it's
to.
just no.
No.
So you're not alone. We're here.
We're
Sandra's
here.
here. Dr. Bauer's here. And we're here to help you.
Yeah.
So please, guys, follow our Instagrams if you like, and reach out to us and message us. And we love hearing from you. We appreciate you and all your questions. We are going to be sharing other patient stories also throughout next week for National Infertility Awareness Week. And we hope that some of you will actually share those stories with others that you might know who are struggling. and maybe they're not asking you directly for help, but they will really appreciate it when you can share that with them. So I think that is all of our questions for the night. I believe that we got to mostly all of them. Let me see here. Yeah, any other questions, please feel free to let us know, and you can message Dr. Bauer and her. What is your Instagram, if you could let people know?
So I'm Jessica Bauer, fertility doc. I think
okay.
It might be an underscore.
There's an underscore in there.
You'd swear I'm like 70 years old and just learned.
You're doing great.
There's an underscore.
Yes, please follow Dr. Bauer, please follow Sandra, and we are at FL Complete Wellness. So we're mostly on Instagram and some on Facebook. And we have, one more question, because it is 1 minute left. We have 1 minute left of our Instagram live today. So someone is easing in that last question there. Okay, and let me see here. BMI, does it affect implantation? So.
Oh my goodness. Yes. It absolutely does. You know, having a normal BMI or body mass index, which it takes into account your height for your height for your weight, or your weight for your height, however you want to look at it, definitely can have, if it is elevated or if it is significantly lower than it should be, can have a negative impact, not only on getting pregnant, but on staying pregnant. It can also, you know, having an elevated BMI has been shown to decrease the chance of success of any sort of fertility treatments. So it definitely is a huge factor. And again, sort of goes back to our discussion about really making sure that you have optimized yourself before, you know, before embarking on pregnancy or embarking on any sort of fertility treatments, because you want to give yourself the best shot. And, you know, furthermore, if you have an elevated body mass index and you do become pregnant, that is associated in and of itself with more complications in pregnancy, like problems with diabetes and blood sugar and blood pressure, and having a smaller baby or a bigger baby, depending on what the issue is. So yes, having a normal BMI and don't let any